Alright, so this video is going to be about the National Asthma Education and Prevention Program by me. In the first video, we're going to cover quite a few different things. So we're going to look at the goals of the NAEPP, the resources, the guidelines, and the goals of the quick reference guide. We're going to look at quality asthma care, the focus of asthma control, achieving and maintaining asthma control, and then what the initial and follow-up visit diagrams will look like. So first, the goals. The goals of the NAEPPCC are to raise awareness among patients, health professionals, and the public that asthma is a serious chronic condition, ensure the recognition of the signs and symptoms of asthma by patients, families, and the public, and the appropriate diagnosis by health professionals, ensure effective control of asthma by encouraging a partnership among patients, physicians, and other health professionals through modern treatment and education programs, and enhance the quality of life for patients with asthma, reduce the burden of asthma, and reduce the number of asthma-related deaths. So then next, this was something that I was asked to add in there. So it says, an NAEPPCC expert panel developed clinical guidelines known as Expert Panel Report 3 for the diagnosis and management of asthma. Selected topic areas in the EPR3 for the diagnosis and management of asthma were last updated in 2020. So then the resources. The NAEPPCC first developed and widely disseminated the guidelines for diagnosing and managing asthma in 1991, followed by revisions in 1997, 2002, 2007, and 2020. The most recent update to these guidelines, the 2020 Focused Update to the Asthma Management Guidelines, provides guidance on 6 selected topic areas. The NAEPP's former National Asthma Control Initiative engaged diverse stakeholders to bring asthma care in line with evidence-based recommendations. NAEPP and NACI resources for patients with asthma and their families and for health professionals are still available. And so then we move on to the guidelines of the NAEPP and goals of the Quick Reference Guide. So the goal of Asthma Care Quick Reference Guide is to help clinicians provide quality care to people who have asthma. Quality asthma care involves not only initial diagnosis and treatment to achieve asthma control, but also long-term regular follow-up care to maintain control. Asthma control focuses on 2 domains. 1, reducing the impairment, the frequency and intensity of symptoms and functional limitations currently or recently experienced by a patient. And then 2, reducing the risk, the likelihood of future asthma attacks, progressive decline in lung function, or for children, reduced lung growth or medication side effects. And then I can't read right behind my head. So I'm going to zoom in so I can read it. Achieving and maintaining asthma control requires providing appropriate medication, addressing environmental factors that cause worsening symptoms, helping patients learn self-management skills, and then monitoring over the long term to assess control and adjust therapy accordingly. So those are the guidelines, and then the goals of the Quick Reference Guide. But there's more. So then there's quality asthma care. For this one, there's a lot to go over. It's 2 big slides. So the first one is asthma diagnosis and monitoring. This involves conducting a detailed medical history and a physical exam, and also using spirometry to assess lung function and confirm the diagnosis. And then there's control of environmental triggers. This involves identifying and reducing exposure to allergens and irritants that can worsen asthma, and also developing an individualized asthma action plan that includes steps to avoid triggers. Then there's pharmacologic therapy. So we encourage the patients to follow a stepwise approach to medication based on asthma severity and control. And then using long-term control medications like an ICS for persistent asthma and quick relief medications like SABAs for exacerbations. And so then on the second slide, patient education. So providing education on proper inhaler techniques and medication adherence, and then also teaching self-monitoring skills, including recognizing symptoms and using a peak flow meter. And lastly, regular follow-ups. Scheduling periodic checkups to assess asthma control and adjust treatment as needed are highly encouraged, and also emphasizing the importance of ongoing communication between the patient and their healthcare provider. So then we have the focus of asthma control. Control is what we aim for. It's the main priority. And what we want to get out of this is that we reduce their impairment, reduce their risk, measure their control, work closely with all healthcare professionals, and then adjust the plan as needed to suit the patient. And so then moving on, achieving and maintaining asthma control. This one is also a big slide. So first, assessment and monitoring. We need to evaluate the severity and control at the diagnosis. We also need to regularly monitor the symptoms, lung function, and quality of life, and use asthma control tests to gauge the controllability. Next, we need to make an asthma control plan. So create an individualized plan that outlines daily management strategies, medication use, and steps for handling worsening symptoms or exacerbations. The patient should know when and how to adjust their medications based on their symptoms. Next, we have environmental controls. So identify triggers and try to avoid them. And then we've got medication control. So using a stepwise medication approach based on the patient's level of asthma severity and control is highly encouraged. And then next on this slide, we have regular follow-up care. So they should be scheduling periodic visits to reassess the asthma control, adjust medications, and reinforce adherence. And we also want to ensure patients understand their treatment plan and are properly using their inhalers. Medication adherence, educating the patients about the importance of taking maintenance medications daily, even if they feel good, will help prevent symptom flare-ups. And also address barriers like the side effects of certain medications, how much they cost, how easy it is to get them, kinds of things like that. Patient education and self-management, teaching the patient self-monitoring techniques such as tracking symptoms and peak flow readings will be helpful to them, and then encourage the patients to recognize early signs of exacerbations and take required action sooner. And so then we've got flexibility in treatment. So the step-down treatment is good for when control is maintained for at least 3 months to minimize medications while maintaining stability. And then the step-up treatment if control worsens following the NAEPP's guidelines. And we'll look at that later on. So this right here is a diagram. That top portion is what it looks like for your initial visit, and then the circular portion at the bottom is your follow-up visits. So as you can see, the first step, diagnosing asthma, assessing the asthma severity, initiate medication and demonstrate the use of inhalers and things like that. Develop written asthma action plans, and then schedule a follow-up appointment. And so then those follow-up visits are going to be kind of a loop that you go through every time you go, starting with assessing and monitoring their control, reviewing their medication techniques and adherence, make sure they're using it right, and also addressing the side effects and reviewing the environmental control. Maintain step up or step down medication depending on how it's working for them. Do we need to go up? Can we go down? Review asthma action plan and revise as needed based on how it's working for them. And then schedule the next follow-up appointment, and you'll just go through that loop time and time again. So that's all I've got for the first video.